Hi, my name is Pallavi Prasad, and today the good, bad, and slightly mixed news about Omicron, the new variant of the coronavirus identified and notified just 2 weeks ago. So, everything is preliminary at this stage. Analysis of patients in South Africa infected with Omicron indicates that the variant is linked to a smaller proportion of deaths. Most patients have not required supplemental oxygen. So, good news. A similar pattern is emerging worldwide, including India, where confirmed Omicron cases are either mild or asymptomatic, even when patients are above the age of 60. The World Health Organization has also underlined this pattern in an interview to AFP. On November 7th, it said, preliminary data does not indicate that Omicron is more severe than the previous Delta variant. If anything, the data is pointing to less severity. The caveat here is that it is still early days. It also said that while Omicron is likely more transmissible and possibly could render vaccines less effective, it is highly unlikely to evade vaccine protection completely, which is existing vaccines will still work to prevent you from getting severe COVID or dying. Case in point, scientists at the Africa Health Research Institute have found that Omicron can partially evade the protection from 2 doses of Pfizer's vaccine. But blood from people who had received the 2 doses suggests that they were mostly able to neutralize Omicron, suggesting that the vaccine still provides some protection and that booster doses of the vaccine could help. In India, scientists have started to isolate and grow the variant. The aim is to test the effectiveness of Covaxin and Covishield and whether Omicron infects those who have recovered from COVID 19 previously. I'll keep you posted on how that goes. On the subject of transmissibility, we have a growing body of evidence that Omicron is likely more transmissible. Due to the unusually high number of mutations on the spike protein, the part of the virus that latches on to human cells, but also because of the speed at which COVID 19 cases are rising since the variant was detected. Omicron accounts for over 90% of all cases in South Africa now, and in 2 weeks it has spread to Botswana, Ghana, Mozambique, Namibia, Nigeria, Senegal, Uganda, and Zimbabwe. Globally, 600 plus cases of Omicron have been detected in dozens of countries, including in England, which is reporting community transmission of the variant. In India, 23 cases of COVID 19 have been confirmed to have been caused by the Omicron variant in 5 states till now. Experts say that the numbers are likely much higher and the chances of them increasing further is only a matter of time. The Indian Medical Association has flagged the possibility of a third wave if adequate measures, including booster doses, are not taken soon. The government is yet to decide on the booster doses bit, but is taking steps to make sure the situation remains under control. India's list of at-risk countries has grown and now includes countries in Europe, including the UK, South Africa, Brazil, Botswana, China, Ghana, Mauritius, New Zealand, Zimbabwe, Hong Kong, Singapore, Tanzania, and Israel. Different states have decided to work with this list differently. Maharashtra, for instance, is not taking any chances. Travelers from at-risk countries need a vaccine certificate and they have to get tested on arrival. A 7-day institutional quarantine has also been made mandatory. If someone tests positive, they are hospitalized. If someone tests negative, they are tested again on 2nd, 4th, and 7th day after arrival. If they test positive in any of those tests, hospital. And if they test negative, home quarantine for 2 more weeks. All those who have connecting flights will also be required to undergo an RT-PCR test. They will only be allowed to board their connecting flight if the result comes negative. Karnataka and Jammu and Kashmir have similar rules, but instead of mandatory institutional quarantine, 1 week of home quarantine plus repeated testing is mandatory for all international arrivals, irrespective of whether they are on the at-risk list or not. All this to say that India is preparing for Omicron much better than it ever has in the past 2 years of the pandemic, and that's something to be hopeful about. In less hopeful news, I did say it was a mixed bag. UK scientists have identified a stealth variant of Omicron that cannot be distinguished from other variants using the RT-PCR tests. I'll give you some context. Most RT-PCR machines look for 3 genes in the coronavirus, but Omicron tests positive on only 2 of them. This is because Omicron has a genetic change called a deletion in the S or spike gene. The glitch means that PCR tests that display an absence of the S gene are being used as a rough way to detect the presence of Omicron. But the new variant, stealth Omicron, lacks the deletion, which means one has to wait till the longer test of genomic sequencing reveals whether or not it is Omicron. And with COVID 19, as we know by now, time is of the essence. As are COVID 19 norms, vaccination remains our key defense against the variant, and only around 50% of India is fully vaccinated. Kids from ages 0 to 17 remain unvaccinated, so the best chance for them to remain safe from Omicron spreading amongst them is if the eligible adults around them get their 2 doses. That being said, there are signs that Omicron can infect those who have been fully vaccinated, even though mildly, in which case, wearing 2 masks, maintaining hand hygiene, avoiding crowded indoor spaces, and ensuring ventilation at home has become touchstones once again. I'll stop here for today. As we find out more about Omicron and its consequences, I will bring you newsworthy updates. Until then, don't panic, just be cautious. Also, please share this video with your friends and family who may be hearing a lot of noise and frantic information around Omicron from elsewhere. This update is 100% in public interest. One more thing. If you're watching on YouTube, do subscribe to our channel and hit that bell icon. You will get notified whenever we upload, and it helps a small channel like ours reach more people. And finally, if you want to go one step further and bet on us, the link to make a monetary contribution towards our efforts to build good journalism is in the bio or description. And every penny counts tremendously. If you have been watching, thank you so much for your time.